Hi everyone! Welcome to today's session. Our topic is nephrolithiasis, or you probably know it's kidney stone. Before we dive in, let me ask you, have you ever heard someone say, "Grabe, ang sakit ng kidney stones"? If you have, then you probably know how painful this condition can be. But today, we are not just talking about the pain, we are going to understand what it is and what causes it, how we diagnose it, and what are the signs and symptoms of this course, and how we treat and care for patients with it. So, by the end of this lecture, you should be able to understand or you should be able to define what is nephrolithiasis and explain its pathophysiology and causes, identify the laboratory and diagnostic findings, and of course, to discuss the treatment options and to understand the role of nurses in managing nephrolithiasis. So, let's get started. So let's first start on defining what is nephrolithiasis. So what exactly is nephrolithiasis? It's simply the formation of stones in the kidney. This stone can develop in one or both of our kidneys. It's most common in people in their 30s to 50s, and usually men are more affected than women. But don't get too confident, ladies, because cases in women are actually increasing too. Okay, now that you know the definition of nephrolithiasis, let's move on to the pathophysiology and causes. Now, how do these stones even form? So imagine putting way too much sugar in your coffee. At first, it dissolves, but eventually it crystallizes at the bottom. That's exactly what happened in our urine when it gets overloaded with calcium oxalate, calcium phosphate, or uric acid. Crystal form, then stones. Let me throw a question. Can you think of condition that might make someone more prone to forming nephrolithiasis or stones? Yup, that is urinary tract infection or UTI, or urinary stasis and immobility. All these crystals that linger in your urinary tract than they should. Another big factor is increase in calcium concentration. This can happen because of hyperthyroidism, renal tubular acidosis, cancer, and tuberculosis, or even too much vitamin D intake. And yes, even some meds like antacids and aspirin can contribute too.
Now, let's talk about the signs and symptoms. Honestly, this is the part patients remember the most because it really hurts. If the stone is in the renal pelvis, there's a deep ache in the costovertebral area. If it's in the ureter, oh boy, the pain is usually severe, colicky, and can radiate down to the groin. And if the stone is in the bladder, the patient may have urinary frequency, hematuria, or even retention. In general, patients experience hematuria, nausea, vomiting, and sometimes diarrhea. Now let me check your memory. What is the most common symptoms? Correct. That is the pain, severe, colicky, and unforgettable pain. So how do we treat it? The main goals are simple. Remove the stone, relieve obstruction, control infection, and prevent recurrence. Pain relief and hydration are always the top priorities. For some stones, nutrition therapy is enough. Others may need procedures like ureteroscopy, extracorporeal shock wave lithotripsy, or the breaking of the stones in smaller pieces, or surgery if the stone is really big or stubborn.
For laboratory and diagnosis. Okay, so how do we confirm nephrolithiasis? First step, we get a detailed history by means of getting family history, diet, medications, all of that. Next, the urinalysis. This can show blood or crystals. Then we do blood chemistry to check calcium and uric acid levels. But here's the star of the show. The most reliable diagnostic tool is the non-contrast CT scan. Did you get it right? Ultrasound is another option, especially if CT scan can't be used, like for pregnant patients. And here's a cool fact. If the patient passes a stone, we actually analyze it to see what it's made of. That way, we know how to prevent more stones from forming in the future.
And now, our role as nurses, we assess and relieve pain, encourage the patient to drink fluids, and monitor urine output. Don't forget, we also strain the urine to catch any stones that might pass. We watch for signs of infection, provide teaching about diet and prevention, and of course, give emotional support. And after procedure, we take care of them post-operatively too.
So to wrap it up, nephrolithiasis is the formation of kidney stones caused by supersaturation of minerals in the urine. It presents with severe pain and urinary symptoms. Diagnosis relies on urinalysis, blood chemistry, and imaging, especially a CT scan. Treatment can be medical or surgical, and nurses play a huge role in pain relief, hydration, monitoring, and patient education. And that's it for our discussion on nephrolithiasis. Thank you so much for watching. But before we end, let me leave you with a question. What's one simple thing you can advise a friend to do daily to prevent kidney stones? Yes, drink lots of water. Hydration is the key.